Hi and welcome to our telehealth medicine information video. I'm Garvin and this video is on Leonore tablets. So first of all, you do not take Leonore if you have or ever had a blood clot in a blood vessel of your legs, your lungs or other organs. If you know you have a disorder affecting your blood clotting. Also, you don't take it if you need an operation or if you are off your feet for a long time. Also, if you've ever had a heart attack or stroke. If you ever have or ever had angina pectoris, which is a condition that causes severe chest pain, or also a transient ischemic attack. If you have ever had any of the following diseases that may increase your risk of a blood clot in the arteries, so severe diabetes with blood vessel damage, very high blood pressure, a very high level of fat in the blood, a condition known as hyperhemocystine anemia. So, Leonore is a combined contraceptive pill to prevent pregnancy. And using a combined hormonal contraceptive, such as Leonore, increases your risk of developing a blood clot compared with not using one. In rare cases, a blood clot can block blood vessels and cause serious problems. Blood clots can develop in veins, and these are called venous thrombosis, or in arteries, and they're arterial thrombosis. It is important to remember that the overall risk of a harmful blood clot due to Leonore is small. So what is the risk of developing a blood clot? The risk depends on your natural risk and the type of combined hormonal contraceptive you're taking. The overall risk of a blood clot in the leg or lung with Leonore is small. So what about other medicines and Leonore? Some medicines can have an influence on the blood levels of Leonore and can make it less effective in preventing pregnancy or can cause unexpected bleeding. These include medicines for the treatment of sudden, unexplained breathlessness or rapid breathing, sudden coughs without an obvious cause which may bring up blood, sharp chest pain which may increase with deep breathing, and severe lightheadedness or dizziness, rapid or irregular heartbeat, severe pain in your stomach. If you're unsure, you can speak to your doctor. So driving and using Leonore, there's no special precautionary measures are necessary for driving while using this medicine. So how do you take Leonore? The recommended dose is 1 tablet a day. Always take the tablet at about the same time of day, if necessary with 1 glass of water. Further intake is in the direction of the arrow, according to the marked day of the week until all 21 tablets have been taken. These arrows are marked on the foil of the tablet. Afterwards, do not take tablets for 7 days. So bleeding should set in this interval, usually on day 2 or 3, after you have taken your last tablet. So if you forget to take a Leonore, so the time of intake exceeded by less than 12 hours, contraception of Leonore is still insured. So immediately take the forgotten tablet and afterwards follow the usual rhythm of intake. So follow the arrows on the back of the foil. So time of intake exceeded by more than 12 hours. So if you forgot to take the tablet more than 12 hours ago, contraception is no longer insured. The risk of unintentional pregnancy is particularly high if a tablet has been forgotten at the beginning or the end of the foil strip. In this case, proceed as I'm about to mention. So only 1 tablet forgotten in week 1. Take the missed tablet immediately Even if you have to take 2 tablets at the same time, then continue intake as usual. However, further contraceptive measures such as condoms are necessary in the next 7 days. So only 1 tablet forgotten in week 2. You take the missed tablet immediately, even if you have to take 2 tablets at the same time. If the tablets have been taken correctly in the preceding 7 days, the contraceptive effect is ensured and no further protective measures are necessary. Only 1 tablet is forgotten in week 3. So only if you have taken the tablets correctly in the preceding 7 days and one of the 2 following possibilities is given, no further contraceptive measures are necessary. If this was not the case, the first of these 2 options should be followed and further contraceptive measures such as condoms should be used for the next 7 days. Immediately make up for the forgotten tablet. Even if you take the 2 tablets at the same time, take the next tablet as usual. Omit the intake free break and directly start taking the tablet from the next foil strip. A withdrawal bleeding will probably not occur, but spotting and breakthrough bleeding are possible during intake of tablets from the second foil strip. Or you could discontinue intake from the current foil strip immediately and stop intake for a maximum of 7 days, including the forgotten day. Then start the new foil strip as usual, where it is possible that you shorten the intake free break. There are the 2 possibilities. If no bleeding occurs in the intake free break, you have forgotten Leonore, it may be possible that you are pregnant. Consult your doctor before starting with a new foil strip. In case of vomiting or severe diarrhea, if you vomit within 3 to 4 hours after taking a tablet, or you have severe diarrhea, there is a risk that the active substance in the pill will not be fully taken up by the body. The situation is almost the same as forgetting a tablet. After vomiting or diarrhea, take another tablet from the reserve strip as soon as possible. So some of the rare side effects: harmful blood clots in a vein or artery, for example in a leg or foot or in a lung. Also heart attack, stroke, mini stroke or temporary stroke like symptoms known as a transient ischemic attack, blood clots in the liver, stomach, intestine, kidneys or eyes. Common side effects of Leonore: vaginal inflammation, including fungal infection, mood swings, including depression and vertigo, headache, visual disturbance, nausea, and pain in the abdomen, acne, breast pain and breast tenderness, menstrual pain. So that brings this video to an end. If you have any questions, you can leave them in the comments below or contact us through our website mytelehealth.info or call into Lynch's Pharmacy, Douglas, Cork, or ring 436 6923 to find out more. Thank you for watching. Stay healthy and stay informed.